All right, we're here with Sydney Cotton, Anthony Villegas. As I said that correct? All right, good. And then Molly Walden. Thank you so much. We're here learning about your project. Tell me about the project that you did and the poster.
So we chose this project because of when we were doing the survey with the ACHS people.
Yeah.
And we had a huge opportunity for improvement on reassessment on pain medications that we were giving to our patients at the ICU. They just weren't being completed at all. We were doing an initial pain score, but then we weren't reassessing at all afterwards.
Okay.
So that's what this project was focused on, and we did this really to help improve patient outcomes and figure out if we're over-medicating or under-medicating our patients.
Because ICU delirium is a real thing, and we don't want that to occur. So what did you all find out as a result of doing the pain assessments?
So our initial was 29 out of 30 charts. We didn't have any charting for any reassessments. And after educating and doing more education with one-on-ones, with surveys, with PowerPoints, with all of that, our results were 66% were better.
That's a huge improvement.
0
That's
to
awesome.
66
Yeah.
is a big improvement. So, and our survey for results of answering our questions correctly of what is the correct thing to do was 100%.
That's excellent.
So people didn't know what to do, which is good, and we aren't over-treating or under-treating pain, and we're effectively sedating and making sure we have a correct interpretation of pain assessment.
So I'm curious, what impact did you see in the actual patient care? How did this impact the way patients receive care?
Well, it's important for us going in the surgical ICU, so a lot of patients are coming out of surgery and are in pain, a lot of craniotomy, so they're having big headaches. So if we're able to go in and give medication and then go back and ask them, hey, do you need more? Do we need to change things up? I think the patients were a lot more satisfied and had better pain control overall post-op.
So you saw a big impact at the bedside. You felt like patients felt better, more with it, less ICU delirium and other things going on?
Yeah, and it decreased drowsiness, which can be confused as a neuro change if they're too drowsy because of pain medication or if they're actually having something going on. So
that's really excellent. So what advice would you give to somebody who's thinking about doing a clinical ladder project? What advice would you give them?
I would just say to focus on something that would make an impact on your unit. Maybe just talk with your manager and collaborate. That's what we did, and I think it turned out well.
Excellent.
Like you said, we're in the surgical ICU, so pain is a real thing. So I think it's just important, if it matters to your case and if it matters to your unit, run with it.
I think just find a good group of people to do it with. I think it makes a big difference. So good support here.
Friends help.
So have good friends. Get work. Identify something that's going to make an impact early on, and then work with your leadership team, and that's excellent. Well, congratulations! What a great improvement, and I know I'm sure it's made a big difference in the lives of patients. Congratulations!
Thank you.
Thanks for telling me.
Thank you.